instead of being at the tip of the penis, is at the undersurface of the penis. So along with that, in some boys there is a bend of the penis as well. So almost in all cases except for the very minor ones, it requires a surgery basically. And the thing to keep in mind is the surgery required for that is a very highly skilled surgery. It cannot be done by any surgeon as such. It requires skilled training, and a lot of experience and good technique to get good results and to reduce complications as much as possible. So in books it is given that you can do the surgery around any time after 6 months and ideally within 3 years of age. I prefer to do it at around 9 months to 1 year of age. So at that age the size of the phallus is good, the weight of the child is also good, and he undergoes surgery very well. So generally at birth, you can see if you examine the penis of the baby that the opening is on the undersurface, and the patient generally does not have any urinary symptoms as such or any complaints of urination, or they don't urinate properly or they cry during urination. None of that is there generally. So whenever you find that there is some abnormality of the penis, or then you should consult a pediatric surgeon as early as possible so that the future plan of the surgery of the patient is fixed in that surgeon's mind. So ideally, if the surgery should be finished within 3 years of age. After, I have got many patients even after that, but the problem happens is because at around 3 years of age, the gender recognition, self-recognition occurs for the patient. So the boys start recognizing themselves as boys, and if their penis is little abnormal as compared to other boys, then there can be this teasing among the friends and it can affect them psychologically. So our recommendation is always to finish the surgery within 3 years of age, before this stage of his life occurs. So historically, the most common surgery which was done and which was popularized a few years back was called TIP, tubularized incised plate urethroplasty. But it was earlier said to be applicable in all types of hypospadias, but over the last few years it has been found that it's not true. I will not go into the details of the surgical technique, but what I have learned over the last 3 or 4 years is that you cannot do a TIP in all hypospadias patients. Some of them requires different procedures like an onlay procedure or a tube urethroplasty or a stage procedure also. And we do the first stage one and then the second stage after 6 months or after 1 year of age. So recognizing which surgery to do in which type of patient and then doing that correctly, following the principles of anatomy and of the penis is very important. That is what will give you the best results. As far as safety goes, the surgery is safe. There is nothing to worry about the general condition of the patient as such. But technically, it is very demanding. It is very difficult to get to do a good job at the time of surgery. So it requires a special skill, a lot of training, and a lot of experience to get it right. So when we do a surgery in a single stage, that time we put a catheter in the bladder that has to be kept in the bladder for about 7 to 10 days. That is my recommendation. Other surgeons have a little different recommendations. So I discharge the patient generally in the next day after the surgery. The parents have to just take a little bit of care that the catheter is still kept inside the bladder for those 7 days till my patient comes back to me for the dressing removal and the catheter removal. That's it. Rest, there is no other specialized precautions as such.